everybody, welcome back to the Teach Back Method, where I teach you guys something I'm learning about in grad school to help me learn the concept better. On today's video, we're going to be talking about physical therapy examination, specifically of the foot and ankle. So we have 9 main categories that we're going to talk about today: static observation, gait analysis, range of motion, joint mobility, manual muscle tests, flexibility, balance, palpation, and special tests. So we're going to be talking about those in relation to a foot and ankle examination. Let's break them down. Static observation is one of the very first things we can do. When our patient is walking into the clinic, we can look at our gait analysis or static observation. They're just standing there before they sit down. So in relation to our foot and ankle, there's a couple of things that we want to check out. Foot posture. Over here I put pes plantar and pes cavus. Those are the 2 main things we're looking for in relation to arch height. So what are the differences? Plantar is more flat-footed or low arch. Cavus is high arch. So low arch and high arch. When I see these words, this is kind of what I think about. So when I see this, I kind of think of plant. When you're planting your foot on the ground, it's going on the ground. Over here, I think of cave. Higher arch, cave. Other things we're looking at is abnormalities. So any swelling or bruising of the leg, ankle, or foot. And we're also looking at callus formation. As I said previously, gait analysis is something we can observe as soon as our patient walks into the clinic. If we're in an inpatient setting and we walk into a patient laying in bed, obviously gait analysis would be at a different time during our evaluation. Now, there's plenty of important things I want to discuss, but the main thing I want to hit home is even though foot and ankle are our main problem areas in this patient, we want to check out the entire body, up and down, when we're doing gait analysis. Not just focusing on the foot and ankle, we want to check out everything. So some of the main points we want to check out are heel strike. Are they striking on their heel? Are they striking more flat-footed? Step length, is it long or short, side to side? Knee valgus and varus, which we'll talk about here in a second. And then our pelvis, are we seeing a drop? Are we seeing any rotations? Things like that. So valgus and varus, we have these little stick figures here. So varus is when we see a patient with their knees outward like this. Valgus would be inward of the knees. Now, if you have trouble figuring out what is it side to side, I'm confused, I'm mixing up the two, I like to think of varus as an R. The length of their leg here is kind of making an R shape. Over here we have an L. So looking on the left leg of each of these stick figures or in their patient, you're looking at the left leg, what shape is the leg making? An R or an L? We're talking about range of motion. There's so many different measurements we can take, but we're just going to talk about the basics. So dorsiflexion, plantar flexion, inversion, and eversion. Which goni do we use? We need to use the smaller one when we're taking ankle measurements, not our bigger one. Another thing I want to preface is remember where we're starting. Are we starting at a 90-degree angle or are we starting right at 0? Don't forget. Joint mobility is a big umbrella topic that we can really spend quite a few videos talking about, but for the purpose of this video, we're just going to be scratching out the surface. There are multiple joints in our foot and ankle that we can check out the mobility on, such as our talocrural, subtalar, intermetatarsal, DIP, and PIP. Now, when we're doing joint mobility, we want to keep in mind the 4 different grades, and we want to test bilaterally. We're going to check out the different soft feel and infeels that we see in these joints, as well as see if it's provoking any pain. Now, if your patient does have pain, it's important to just stick with grades 1 and 2. We don't want to go into 3 and 4 grades if they have pain. The main muscles we want to check out with our manual muscle testing of the foot and ankle include our tibialis anterior, tibialis posterior, peroneus longus, peroneus brevis, gastroc, and soleus. Now, is it appropriate to test farther up? Absolutely. We definitely want to check out the different manual muscle tests of both our knee and our hip, because problems farther up can go down to our foot and ankle and cause other issues. In the spirit of checking out our whole system rather than just having a microscope on our foot and ankle, let's talk about flexibility. So the closest things to our foot and ankle, of course, are gastroc and soleus flexibility tests, but we do want to look higher up. So we're also going to check out the 90-90, Thomas, modified Overs, and Eli's. So obviously that's higher up. We're looking at the Hemis, rec fem, IT band, etc. Because as we know, the whole body functions as a system. So there could be something higher up that's causing the issue or some compensation happening. That always goes back to our gait analysis or observation too. Those are some issues we might see as soon as they're walking into the clinic that we know we want to check out later. When it comes to evaluating balance, there's so many different directions we can take it, but I put some main hitters up on the board. We are single leg stance, step down, and functional reach. Your patients may be wondering, why do we need to assess balance? Or even further, why do I need to work on my balance? I don't stand on one leg all day. Well, when it comes to functional activities of daily living, there are many times where we do stand on one leg for short periods of time, such as stepping into a car, going upstairs, etc. So functionally, balance is a very important part. When we're palpating the foot and ankle, it's important to save it towards the end of our evaluation, as palpating can cause our patients pain and they might not want to continue with the full evaluation if we did it first. There are many different things that we want to palpate when we're checking out the foot and ankle region. Many of these things are insertion sites for different muscles and ligaments. Here's a couple things we want to check out. Of course, we want to check out our calcaneus, our fifth met, or specifically the fifth met styloid process. We want to check out the talus, all the different sides, right? So our medial side, lateral side, as well as the talar dome. We want to look at our navicular tuberosity over here and the ligaments. So obviously with the bone structure, I don't have the ligaments, but you know what I mean. We want to check out the deltoid ligament, CFL, ATFL, things like that. The last thing I want to go over briefly are the special tests of the foot and ankle. Just like palpation, we need to save this towards the end of our evaluation, as this oftentimes does reproduce pain for our patients. Now, here are some of the special tests we might see and do in our clinic. Anterior door, talar tilt, inversion stress test, external rotation, impingement, squeeze, Thompson, and Tensils. Obviously, we're not going to do a full list of special tests. The patient's going to come in with certain complaints. We're going to see other things during our current evaluation, and we're going to have some sort of a hypothesis of what we think is going on. So perhaps maybe we suspect a high ankle sprain. Maybe we suspect an Achilles tendon rupture. That's going to help us determine what special tests to do to help confirm our hypothesis. So for those examples I just gave, if we suspect a high ankle sprain, we're going to want to perform the squeeze test. If we suspect an Achilles tendon rupture, we're going to want to perform the Thompson test. I hope you guys enjoyed this brief video regarding the evaluation of the foot and ankle. I'll see you guys later.